Welcome to the Alfred Hospital, one of Melbourne's oldest and most respected hospitals. The Alfred Hospital is the centre for adult heart and lung transplant operations in Victoria. It also cares for patients from South Australia, Tasmania, Western Australia and New Zealand. Joining the heart-lung transplant program may be one of the most significant steps you will ever take. And once accepted onto the program, it will have an enormous effect on you for the rest of your life and that of your family, close friends and workmates. This video program is to help you understand the steps that you will take before, during and after your transplant operation. Right at the start, you should realise that undergoing an assessment does not automatically mean that you will proceed with the transplant. So let's take you through the program. We'll begin with your referral to the unit, your assessment, being listed by the transplant coordinators, the time you'll have to wait for a suitable donor organ, then being notified, coming to the hospital, the operation, your time in intensive care, your time in hospital, and then what happens once you leave the hospital and return home. The reason that you and your family are watching this program is that you've been referred to the Alfred Hospital Transplant Unit by your doctor or specialist, because it appears at this time there are no other medical or surgical avenues of treatment available to you. Your first contact will be with one of the transplant unit physicians, who will discuss with you the suitability of a transplant for your condition, alternative forms of treatment, as well as what is involved in the transplant process. It's worthwhile to have someone with you at this meeting. It's hard to remember everything that's discussed, and a family member or close friend can help in talking through all the issues. This support person, or carer, has a most important role to play. It's after this meeting that you will need to make the decision about whether you wish to be assessed and considered for a transplant. Although you may have decided to go ahead, you will have to undergo a very detailed medical and psychosocial assessment to make sure that you're a suitable candidate. This assessment will take the form of a large number of tests: your heart and lung function, condition of your other organs. You may be found to have some other condition which prevents you from entering the program. Smoking or heavy alcohol use may be an issue. During your assessment, you will meet members of the transplant team. They will assess both your suitability for transplant and provide suggestions to help you with any problems you're encountering because of your illness. They then meet and make the decision to list you for the operation. So during your assessment, you'll meet most of the transplant team. Associate Professor Don Esmore is the senior surgeon in charge of the unit. Either he or one of the two other surgeons on the team will perform your operation. There are two groups of physicians: cardiologists and respiratory physicians attached to the unit. As well, there is a large support group on whom you'll rely during the time before and after your transplant. Two social workers, who are trained counsellors, are attached to the unit. Before you begin your assessment, you and your family may wish to discuss the many issues that are involved. The social workers are very happy to see you at this time. They will also help with nearby accommodation, travel arrangements, financial questions, anything that will allow you to lessen your concerns as you approach the operation. It's not unusual for transplant patients to experience quite severe emotional problems, mood swings and the like, both before and after a transplant, and counselling will help both you and your family cope with this. A consultant psychiatrist is also available if required. They say that your rehabilitation starts from the time you're assessed, and everyone on the team wants you to have the very best result. Occupational therapy aims to enhance people's quality of life by enabling them to participate in their chosen life activities. These may include looking after yourself, activities around the home, work, leisure or driving. The occupational therapist may recommend strategies or equipment to make these daily activities easier and minimise fatigue. Stress management and relaxation skills are very important. The occupational therapist can help you master these techniques in preparation for the transplant process. Before the operation, you need to get into the best possible physical condition. So exercise and breathing programs that will help both before and after are essential. And the physiotherapist will help guide you through these. And obviously, your diet is most important. You and the dietitian will work together to make sure your body is as healthy as possible, as well as dealing with any eating or nutritional problems you may encounter. The dietitian is there to help you achieve a healthy weight, control a raised cholesterol level, diabetes or any other related nutritional problem. And you will also receive help in developing a suitable post-operative diet. And of course you'll meet the transplant clinic nurses. They will discuss aspects of the operation itself and your care afterwards. In the clinic, they will monitor your progress after the transplant and look after your follow-up care. So, having undergone your assessment and met the team, you may then be told you're an appropriate transplant candidate, and you'll be placed on a waiting list for the operation. By this stage, you will have met the transplant coordinators. They'll be your regular contact with the team in the time leading up to the operation. For many patients, this is a very difficult time, because the waiting time can be so varied, from weeks to months, even longer. The coordinators, who are on call 24 hours a day, and the team are there to help, assist, advise and guide you and your carer before and after the operation. You'll be given a beeper so that you can be contacted at any time. You will be invited to participate in education groups. Your health will be monitored very carefully, and you'll have the opportunity to meet the other people who are either waiting for or who have received their transplant. And the circulator, the quarterly magazine compiled by the patients, can be quite helpful. If you would like to meet someone who has had a transplant, someone who's been through the procedure, the team will arrange for them to share their experience with you. It may be that during the waiting time, your condition deteriorates. You may have to come into the hospital for specialised treatment, or you may be able to receive supportive drugs or treatment at home. A possible treatment is insertion of a ventricular assist device or an artificial heart machine. This will provide cardiac support and may allow you to live at home whilst waiting for a transplant. Then will come the notification, the phone call or your beeper if you're away from home. You'll be told that an appropriate donor organ is available for you, and you will be asked to come to the hospital as quickly as possible. The coordinator will help you with travel arrangements. Remember, the fact that you have been called does not necessarily mean that your operation will take place. There is always the possibility of a cancellation for a whole range of reasons, so be prepared for that to happen, and the disappointment. For a donor organ to be available means that you've been offered a gift of life from a person or a family of a person who has suffered irreversible brain damage. Someone who has been declared brain dead. It's something worth thinking about. Once admitted to the hospital, you will be prepared for your operation by the nursing staff and resident doctor. While the surgeons know everything about you, they are now making sure that the available organ is suitable for you. The compatibility of blood groups, the size of the organs compared with the size of your chest cavity, your physical condition, the time you've been on the waiting list. All these things are taken into account once an organ is offered. Then, accompanied by a nurse, you're off to the operating theatre. A counsellor or transplant coordinator may also be able to accompany you into the theatre. Once inside, the anaesthetist will start inserting the intravenous lines necessary to monitor you during the operation. Then you will be anaesthetised. A transplant operating theatre has a lot of equipment and people. This might be a good opportunity to look around. There are usually 5 people around the operating table: the surgeon, an assistant, and the theatre nurse with a scout nurse. This is the heart-lung machine, which takes over your heart and lung functions while the operation is taking place. The anaesthetist is there beside the anaesthetic machine with its railed monitors. To the side is the perfusionist, closely monitoring the heart-lung machine. During the operation, your family can be close by. Quite often they return home, or they can spend time in the nearby garden or the chapel, and there's a cafeteria not far away. Arrangements can be made for them to be accommodated nearby. The amount of time taken for each operation varies, but generally it's more than 6 hours. As soon as practicable, after the operation, the surgeon will talk with your relatives. Once the operation is over, you'll be taken to an intensive care unit, where the doctor and nurse will monitor you continually. Your family can see you here shortly after you arrive. Because of the techniques used in the operation, your body will be very pale and quite cold, and you'll be wrapped in a silver space blanket. How long you stay in intensive care again varies on how easily your body begins to cope with the newly transplanted organs. During the early post-operative period in intensive care, you may feel quite strange and uncomfortable. You will be connected to a number of tubes, which will help your breathing, provide fluids, and relieve your pain. You will also be connected to a number of monitors which tell the nursing staff how your body is functioning. Your pre-operative breathing exercises will help you considerably as you relearn to breathe deeply and cough. Gradually, over a period of time, some of the tubes will be removed, and you will then be transferred from intensive care to the cardiothoracic or respiratory ward. In the ward, you'll be working with the nursing staff in learning to take your own medication, the cyclosporin, Imurin and prednisolone, how to record fluid intakes, your weight, and all the other factors that will help your recovery once you leave the hospital. Biopsies and bronchoscopies of the transplanted organ will be performed while you're in hospital and following discharge to check for signs of rejection. The physiotherapist, the dietitian, occupational therapist and the social worker will see you regularly during this time to help you recover from your operation and prepare for your new life. You will need a lot of help from the transplant team in these first weeks and months. If you come from far away, you'll need to arrange accommodation nearby. The social worker will help you if necessary, and you won't be able to drive for 6 to 8 weeks, so that may be an added inconvenience. Once you leave hospital, you will need to come back to the clinic fairly regularly. At the beginning, 3 times a week, but these visits will decrease as your condition improves. You will be examined regularly to make sure there are no signs of rejection or infection, and you'll be taught how to recognize these important symptoms. There are a number of group education sessions held at the hospital that will help you adjust and care for yourself. There are also groups to help your carer during this stressful time. It will be crucial that you keep up your exercise and activity routine, and that you maintain the diet that's been recommended for you. As we said at the beginning, this may be one of the most traumatic and emotional experiences you will ever undergo. The better prepared you are, the more likely you are to have a complication-free operation and early recovery. The ongoing medical research being undertaken by the unit means that there are continual advances being made in the areas of rejection, infection and drug therapy, as well as other therapies to aid your operation and recovery. All of the transplant team are there to help you. So whatever you need, whatever you want to know at any time from now on, don't be afraid to ask. They want you to have the best possible outcome so you can return to a normal and fulfilling life. Oh, and all the best.